Okay, hi, it's Dr. Buford. We're just getting started on the left shoulder. We're looking in from the back to the front. We wanted to go ahead and have our first look at the biceps anchor because that's one of the decisions we wanted to make today. The biceps tendon here looks great. I don't see any signs of a problem here with the biceps tendon. As we look down at the biceps anchor, that actually looks pretty good. You can see you've got a bit of a cord-like middle glenohumeral ligament inserting here. And the labrum starts up again down here, so there you go. I can't quite get underneath it all the way, so maybe it's not quite a full-on complete cord, but it's pretty close. And there's the biceps tendon. Now we'll look up at the rotator cuff, and this looks great, so that's really good news. So I think inside the joint, we're going to be happy with this. We're not going to have to do anything. I'll show you some more in a minute. Okay, just wanted to show you here, this is the end of your clavicle on the left side of the screen. And so we're just finishing this distal clavicle excision. It used to be called the Mumford procedure. I guess it still is. We just don't use that word as much anymore. And we can see that based on the width of this burr, we've got plenty of space now. There's still a little bit of acromion here that we can remove to make sure that there's nothing rubbing anymore. And we can see all the way back that we've got at least 7 millimeters, I would say, 6 or 7 millimeters of space between the clavicle on the left and the acromion on the right. As I pull back a little bit, you can see that. Okay, and so go ahead and push on the clavicle, just to the, right there, to the little bit more interior. There you go. And so as we push on the clavicle, you can see that we're all the way up to the top of the clavicle, and that's clear. So we're going to finish up, we've also done the decompression, where we took off a little bit of the anterior acromion. The rotator cuff looks great on this side, so there's no problems with the cuff. And now we've got this AC joint resected. Okay, and that looks pretty good. Okay, so hold that. We're going to rotate the camera around. Here's the acromion at the top of the screen. You can see the AC joints back here. Right there. That's the clavicle that's moving in the distance. The acromion looks nice and flat. The rotator cuff down below is nice and solid. Looks normal, very normal. So this will be good news for you. You're going to recover a lot quicker. So good luck to you now. Bye-bye.